Hello, this is Dr. Carl Hansen. I'm a family practitioner in Louisiana. And with the Louisiana Academy of Family Physicians, we continue our educational series on how to start an independent practice. Now, this episode is going to be about how to find or whether to choose a healthcare attorney as part of your practice. There is a document that accompanies this section which goes over certain details and things to look for, but there are certain things maybe to transmit maybe by just discussion or more of a narration why this having an attorney is a consideration too. The first item is, do you need an attorney at all? Can you navigate the contracts and the legal issues on your own? And yes, you can, and you may do fine if you have a lot of good attention to detail, and you can have AI systems analyze and contracts or even construct contracts. You can do that. And especially if you're not employed. So we're talking about independent practice. Certainly if a physician is going to be employed, they absolutely must have in my opinion, a healthcare attorney, because an employment contract that a physician signs is full of a lot of stuff that the physician needs to have somebody expert in telling them what to look for and what to look out for. But if you're an independent practice, maybe you're obviously not going to have employment contracts. However, you may be just leaving employment, and so there may be consequences of leaving an employer to start your independent practice. Just know that in independent practice, you're signing a lot of different agreements, business associate agreements and contracts, non-employment contracts. But you're signing leases and agreement to do this, that, and the other thing. And then, of course, some practices go with the insurance-based model where you're signing insurance contracts. So you're, as a physician in independent practice, you're signing a lot of legal documents. It can be overwhelming. Just letting you know, there's a lot of stuff that you sign. It can be overwhelming. Not that it's going to cause any great stress, but it's just a lot of volume of stuff to get through off on the front end. So the other aspect is that contracts are probably becoming increasingly complex, and the jargon associated with that is a jargon often unique to the legal industry. And so you want somebody that actually knows that part of it. So do you need an attorney? It's not required by law, but I think it would be certainly good advice to get an attorney on board to help you with that first. So as the document points out, one of the ways is that it's trying to help us is figure out how do you pick an attorney. I think one thing that's important is if you have availability for a person who has healthcare experience, I would do that. They don't necessarily have to be healthcare certified, but that would be a feather in their cap for sure. But you want somebody who's actually looked through contracts that we sign, and they see the trap doors and the thin ice, etc., that we need to look for as physicians. I would think that in looking, ask around, but when you go to a law firm, if you're going to go to a law firm, find out if they have somebody who's specific for healthcare. They may indeed have that, and then you could interview them. So I would lean certainly towards that direction. The third item for why related to getting a healthcare attorney is the issue evolving around proper construction of your practice. So some of us may be business savvy and know about how to construct a practice, but if you don't, then an attorney can help you make sure that you're in compliance with your state laws if you choose to form a corporation. Not that that's complicated, but if you have somebody who is taking that oversight, then that maybe takes a burden off of yourself. But every state has different laws. So you want an attorney that is conversant in that individual state's law. So obviously Louisiana has much different laws than others. So you want a healthcare attorney that doesn't just know about healthcare in general, but knows about laws specific to the state. So that would be another item that would be of importance as far as picking an attorney. Constructing your practice does take a little bit of attention to detail that the attorney can handle if you don't feel comfortable doing that. The fourth item is future ventures. That's really important because as an independent practitioner, as your practice grows, there are going to be a myriad of doors that open up for you that you had no idea that were what's going to happen. that a lot of opportunities will appear on the horizon that you had no clue that you're going to be exposed to. All those new opportunities, whether there's a directorship or oversight of something or constructing of a different type of healthcare entity or a 501c3 charitable corporation, etc. All these entities that are going to pop up either in real life presented to you or pop up in your brain to construct on your own, you're going to need to have those constructed. So that's going to require a certain amount of documents. It may require the formation of articles and bylaws, etc. So you want to have an attorney that helps you properly construct some of these new ventures. That may be a little bit more burden than you're willing to take on, because you and your attorney can discuss whether this new venture is right for you. And then if so, how do you want to construct it? And then so that attorney will then construct it as you see fit. So that is an important concept that maybe at the beginning of your medical practice, you're not seeing, but it's going to happen. And that's a good thing. The fifth item has to do with the relationship. So once you've established a relationship with an attorney who is well-versed in law, y'all both learn from each other. And as your practice matures, that attorney is going to have certain contacts that you don't have, and will also be able to often give you certain advice you have. So I think establishing the attorney's with a relationship with the attorney early on and having that mature over time, rather than not having an attorney and deciding when you feel like there's some trouble around that you're calling attorney out of the blue, that suffers a bit because there hasn't been that relationship. Sure, an attorney can handle a sight unseen issue, but it's a lot easier if the attorney has some background, some relationship with you. So getting the attorney early also, of course, potentiates the fact that you'll have more of a long-term relationship. So in summary, the overall recommendation is that an individual who is in medicine should have an attorney on retainer, or at least a relationship with one, and that attorney be brought in early to the construction of any new venture or any new practice, that the preferably attorney who has experience specifically in healthcare law and maybe even certified. So that would make your life quite a bit easier on handling a number of complex issues as you navigate through medical practice, and makes the medical practice more fun knowing that you have somebody who is bird dogging over you to make sure that you're in legal compliance. And that's something that you do not have to worry about as far as a burden. All right. Well, thank you for listening. We'll talk to you later. Bye now.